We need to move on. We have a patient of Dr. Esch's. Colleen, if you wouldn't mind coming up. And if you would put up the slides. Colleen was nice enough to spend a little time talking to me last night. I'll give you a little history about her. And what I'll do is I'll take you through my exam relatively quickly, and then I'll defer to Giovanni and Matt and see if they have any input, and we'll go from there. If I could have the slides for case presentation number 1. And if I could have the lavalier mic on. Hi again. Hi. I'm Ben. Okay, this is Colleen. Colleen is 17 years old. She's about to be a high school senior after the summer. She plays water polo and swims. Her history with which she presented to Dr. Esch about a month ago was that last fall when playing water polo, she had soreness in her shoulder. A few months later, she felt her shoulder dislocating while she was swimming backstroke and had cracking and popping when swimming freestyle. If her elbow comes above her shoulder, she feels her shoulder come out, and actually she refers to it as a dislocation. She has no symptoms below 90 degrees, popping in the cocking phase of throwing and when she was swimming. Next slide, please. It's sore when she elevates her arm or with weightlifting, but the comment that she made last night was, I can deal with it. She denies any distal symptoms, tingling, numbness, or radiating pain. She denies any previous injuries. Nothing else makes it worse, and nothing has improved it. She's been in physical therapy, and from the description that she gave me last night, she's been doing a very reasonable scapular stabilization and postural training program. She feels stronger, but her symptoms are the same. Do you want any other information? Okay, so let's take a look. So if you would just stand and and if we could have the camera on, and I just need you facing forward for a moment, just the way you are, sweetie. Okay, so I'm going to...
How many dislocations?
Whenever she swims backstroke, she feels it. Every time she comes in backstroke, you feel it coming out.
Yeah, I can do it whenever.
And you may get to see that if you're good. Okay. So, if you'll face forward, I'm going to be moving around you, so I won't have to have you turning. So the things that I'm seeing, let me turn you to the side that way, and I'm going to step down, and I'll tell you what I'm seeing. Starting from the foot, her right foot is externally rotated a little bit. We'll see that better. Can you pan down so we can... That's not... Just take a step back if you would, Colleen. That's not my head, just so you... Okay. Okay. So what I'm, one more step back, please. I'm sorry. Okay, so what I'm seeing from here is her right foot is externally rotated. Both knees hyperextend. She's got a very significant anterior pelvic tilt. She's got a very significant lumbar lordosis. Her arms are in front of her body. Now, remember I showed you my yoga instructor and her hands were right at her side. Her head and neck are a little bit forward, and it's hard to tell from this position, but I suspect that her scapula, at least on the right, is a little bit, and I tend to be a purist and don't talk about protraction, but anteriorly tilted and slightly internally rotated. So now if you would just make a 90-degree turn, so I'm looking at you from the back. Okay. So now, right foot a little bit externally rotated, and now I'm looking more at her arm position and her scapulae, and if I reach up, here's the inframedial border of her right scapula, inframedial border of the left. So position's not too bad. My cheat for looking at the scapula is put your hands on your hips, if you would, please, Colleen. Thumbs back. I put them in this position. This is Ben Kibler's lateral scapular slide, position number 2. And we can talk about his whole test, but it's too time-consuming for me in the office, so I tend not to do it. So what I'm seeing here is the right scapula is internally rotated because it's more prominent here than what you're seeing here. And I can usually show the patient by just having them feel my hand as it comes across. It doesn't drop off as much here as it does on this side. So that's my cheat to get a feeling for if they are going to have a scapular problem. Put your hands at your side, please. And now put your feet about hip distance apart. And now stand on your left leg. Okay, little problem with balance, and the first thing she did was her right hip hiked. So there's a core issue here on the contralateral side, not uncommon in throwers. And now do a little partial squat. Okay, a little bit more. You can't cheat by putting your feet together. You can't do that. There you go. Okay, and come on back. So what you're seeing is loss of external rotation control of the hip. So she's got a lumbopelvic weakness. Her gluteus medius is kind of weak. Now we'll go to the contralateral side, right side. Stand on your right, please. Okay. Again, the pelvic shift to try to balance. And now pick your right knee up forward, if you would. Just bring your right knee up, please. Up, your knee up. No, there you go, sweetie. Thank you. I'm sorry. Okay, little difficulty with balance. Core issue, and now in that position on this side, we'll have her do a little partial squat. And again, internal rotation. So there's a core and lumbopelvic issue. So you can stand up now. So let's let that stuff go. We know that's got to be addressed in physical therapy. And bring your arms out to the side, up and overhead. And let's see what her scapular kinematics are like. If you look in this position, if you zoom in and look just here, look at the difference in her shoulder creases, which tells you that there's a scapular tracking problem. Okay? The creases here are clearly different from what they are on this side. That's another cheat to look for it. And now bring them down slowly, if you would. Keep going. Are you feeling anything funny as you do that? Okay. Now go forward, if you would. Bring your arms back down where they were for just a moment. When she comes down to rest, after that, her right shoulder is a little bit lower than her left. Okay, so now bring them forward if you would. And this is where you usually see scapular dysfunction more in forward flexion when lowering the arms than when raising them. So go ahead up. Okay. Little difference in the amount of abduction as she comes into forward flexion. And now bring them down, please. Okay, so as she comes down at about 90 degrees, the whole medial border of the scapula kicks out. That's Ben Kibler's type 2 scapular dyskinesis. So you know that there's an issue with that. Now what I would do now, because of the history of her coming out, is, and from what Jim told me he saw in the office, is ask her to go through the motion that allows her shoulder to come out. So let's have you turn that way, and go ahead and do it if you don't mind.